You unlock this door with the key of compassion. Beyond it is another world, a world of science, a world of common sense, a world of sanity. You're moving into a land of both empathy and ethics, of nutritional knowledge and empowerment. You've just crossed over into Dr. Osborne's zone. Welcome to Dr. Osborne's zone. Today we're going to be talking all about surgery, complications that cause the need for surgery, complications that arise as a result of botched surgeries because of the failure to look at nutrition, nutritional status. And that's what you want to walk away with tonight. Now, we're going to be talking about a lot of different things like how you can prepare properly nutritionally for a surgery, what supplements are safe to take before your surgery, and what supplements you should avoid before surgery as well. We're going to be talking about some strategies nutritionally that might help you heal and support your ability to heal post-surgery should you need one. So let's dive in. Let's first define really what surgery is. So if you really want to think about what surgery really is scheduled trauma. A lot of people don't see it this way, but just like you could have a traumatic fall and sprain or break a leg or an ankle or something of that nature, that what we would call trauma, right? Surgery is a form of scheduled trauma, and one of the reasons why is that when you're going into surgery, you're basically you're being cut open, right? And so you're being cut open to have something removed, you're being cut open to have something stitched back together internally, or you're being cut open to have a bone reset, or whatever it might be. Maybe it's a herniated disc, and so they're cutting you open to remove parts of the bone spurs, etc. So again, this is a huge form of trauma because your body has to heal from the surgical incisions and the damage that the surgeon's going to do to you. Now, sometimes surgeries are necessary. This show is not about trying to demonize or bastardize all forms of surgery, but it's just to help you understand that this is a trauma. Trauma requires nutrition to heal. And this has been known for a very long time. You need adequate nutrition to heal from the trauma. And oftentimes, if you had adequate nutrition before the doctor told you needed surgery, a lot of times you may not have even needed the surgery, and this is especially true in the form of many of GI surgeries, gastrointestinal surgeries, which we'll talk about. Now, we look here, we see malnutrition, just what I was saying a minute ago. Malnutrition can cause disease that leads to the increased need for more surgery. So malnutrition, this is very, very important because one of the things that you can do if you're trying to be preventative and in your mindset is to have your nutrition status checked when you go see your doctor on your annual checkup or your biannual checkup. It's just very, very important to look at your nutritional status. Otherwise, again, you remember malnourishment is not, I'm not talking about like wasting away. Most people think of malnourishment, you think about, the old commercials from the 70s where they were saying send money to the starving kids in Africa, where the kids were emaciated and had ascites, big stomachs out to here, but the rest of their bodies were all skin and bone. That is a very, very different kind of malnourishment. That typically in third world countries is called kwashiorkor disease or protein malnourishment. But the vast majority of the industrialized population is malnourished in some way or another. They're not malnourished in the form of total calorie intake. They're malnourished in the terms of they're not getting adequate vitamins and minerals. And so, as an example, low vitamin C and low B vitamins, particularly B12 and folate and B6, can lead to increased risk for heart attacks and clots. And so what happens to a lot of people is they end up having to go in with their cardiologist and they're having to do opening of their arteries with balloons or other devices to open up the arteries because they've had a narrowing of the arteries or they've had clot or plaque formation in their vessels. And so these are nutrients, and if you have enough of these nutrients, a lot of times you can defend yourself from this happening, and then subsequently the later stage of a heart attack, again, for a lot of people is to have different agents inserted into their vasculature to open their vasculature up, and those are very invasive surgeries, sometimes open heart surgeries and things of that nature. So again, just a common example of how nutrient deficiencies can be present and can increase the risk for damage to your body, which then adds on the need to have a later surgery. And once you have that surgery, you know, again, what we said a minute ago, surgery is scheduled trauma. Now you've got trauma that has to heal after the fact. And so if you're malnourished going into that thing, so if you have malnutrition going into that thing, then the opportunity for that surgery to fail, and actually this is called failed surgery syndrome. That's an ICD-9, ICD-10 code. So a lot of times when people have bad outcomes with their surgery, they get this diagnosis. So this is, it's such a common thing that happens that there's a diagnostic code criteria for it. So you want to minimize, again, we're trying to talk about today about minimizing the risk of you having a surgery gone bad because of malnutrition. And then once the surgery goes bad, of course, that contributes to further complications. And so then a lot of times when your surgery goes bad, doctors want to come back in and do another surgery, right, or do a follow-up surgery, and you're already malnourished, so the cycle just kind of repeats itself, and you end up worse for wear, unfortunately. Let's shift over here. So look at this. This is a great study overview on the prevalence of malnutrition after major surgeries, and you can see here, in the abstract of this paper, since Butterworth first published his paper, The Skeleton in the Hospital Closet, in 1974. So again, this is not new, right? It's been known that malnutrition is a significant factor in determining the outcome or illness for many patients. However, the problem still exists 20 years after this publication, actually even yet today, because this was published in 2003, so we're actually 40 years beyond this at this point. Those who undergo major surgery are at greater risk of malnutrition than most because of the stress and the concomitant increase in metabolic rate caused by the surgery itself. So the surgery, again, which is scheduled trauma, increases the need for nutrients in order for the body to be able to heal and repair itself. And this is very, very common, and it's very, very well known. If we look at this other research study, vascular surgery, patients at risk for malnutrition are at an increased risk of developing post-operative complications. That means that they're at a greater risk for having a problem after the surgery is over. So you can see in this particular study of 468 patients, 24.1%, that's a quarter of the patients were found to be at risk for malnutrition. And the occurrence of post-operative complications in the people that didn't have high risk of malnutrition was 23, almost 24%, versus almost 52% in the malnourished group. So twice as many complications in those with malnourished risk factors, at least in this particular study. Now let's look at, now that we've established that surgery is scheduled trauma, we've established that malnutrition can create the need for some surgeries and that surgeries can cause malnutrition. And so there's multiple things going on here. Let's talk about some of the studies that, or some of the, not studies, but some of the actual surgeries that directly can cause malnutrition. So aside from the fact that surgery creates an increased metabolic function and need for healing and can cause malnutrition, some surgeries are even worse because they're performed on areas that are essential for your body to receive nutrition. And so I've chosen these four to talk about tonight. It's, again, these I don't want you to think that it's limited to only these four surgeries, but these are just four very common ones. So the first is a tooth extraction. And a lot of people don't think of a tooth extraction as a surgery. And many people that get a tooth extraction, depending on what happens beyond the tooth extraction. So if you have a tooth removed, maybe an infectious tooth or a dead tooth, what happens now, you have a gap or a space that's left. So when you go to chew, for every tooth you don't have, it reduces mastication, meaning it reduces the physical breakdown of the food that you eat as you're trying to chew it. And so ultimately, if you have enough tooth extraction, and we see this in a lot, especially in impoverished communities where you find a lot of individuals have very poor dentition and they lose several of their teeth, and then you get false teeth that people have to use, which are nowhere near as effective at chewing and breaking down and helping to physically digest the food. And so what you end up with is malnutrition from the inability to break food down. Now, some people after a tooth extraction will have an implant put in, and implants are really, really solid. They work really, really well. at preventing the post-tooth extraction patient from becoming malnourished as a result of not being able to properly chew their food. So again, implants are something that, if you're having tooth extraction, you want to talk to your dentist or dental surgeon about, because you don't want to run that risk for malnutrition after the fact. Now, tooth extractions also do a lot of damage to the collagen matrix of the gum tissue. And so one of the things that's very important, if you're scheduled for a tooth extraction, it's very, very important that you understand that there's a lot of damage that's going to happen to your gum tissue post the fact. And this is why complications can occur after tooth extractions, things like dry socket or post-complication infections. So it's important that you know, and we'll talk in a minute about this, so stick with me. We're going to talk about the strategies, the different nutrients you need to supplement with, or that you should be taking, to enhance your body's ability to be able to heal after a surgical procedure. And we also have bariatric surgery. So, for many of you that have ever had, there's surgeries like stomach stapling or stomach reduction, like the Roux-en-Y gastric bypass would be an example here. Gastric bypass is a surgery whereby they reroute and kind of bypass the stomach area, or shrink or do a lap band where they actually decrease the surface area in the stomach in order to make people full more quickly to lose weight. And so this is typically a surgery done in people that are morbidly obese in order to help them lose weight. Actually, I had a patient, and this was just like a month ago, and she was on the list for getting a bariatric bypass surgery done. And so, but we had been working with her, and so I had her change her diet. We checked her for nutritional deficiencies. We checked her for food sensitivities, and we changed her diet all the way up. And so what ends up happening is she loses like 40 pounds in a month. And so she's no longer eligible for the bypass surgery. And so what does her surgeon tell her when she goes to follow up with the surgeon? He says, you need to start eating ice cream and Snickers candy bars in order to put more weight on, because otherwise you're not going to qualify, and I'm not going to be able to do the surgery on you. How ridiculous do you think of that. The surgeon is telling her to destroy her health so that he can operate. And I think probably he was financially incentivized to give her that advice, because he certainly wasn't looking out for her well-being, because here she had worked so hard changing her diet to lose enough weight where she no longer required the surgery. So, but at any rate, bariatric surgery, because what happens is you reduce stomach surface area. Remember what the stomach does, very important functions as far as the stomach is concerned. Let's make a little room here. So one of the things that the stomach does is it secretes through parietal cells. There's a specialized type of cell in the stomach. You make acid, right? Hydrochloric acid, and then you make something called intrinsic factor. And the acid is very important for protein processing, for protein breakdown. So how do we absorb and digest or break down proteins so that we can absorb amino acids? We do that with stomach acid, right? And so if we bypass the stomach, we reduce acid capacity or acid action on the food, and so you can end up creating protein malnourishment. But you also need stomach acid for vitamin B12 and magnesium and calcium and zinc, and several other nutrients. And so by doing this type of surgery, you really put yourself at huge risk for long-term malnutrition and complications of malnutrition, which again, it's that vicious cycle. The surgery itself is scheduled trauma, which creates malnutrition. But then if the surgery creates a reduced capacity for your body's ability to take nutrients from the food and creates more malnutrition in the process, how well do you think the outcome is going to look in these individuals? We also have surgeries like bowel resections, and so that you can have small bowel resection or small bowel removal where somebody has parts of their small intestine removed. You can have large resections, which is where parts of the colon are moved or chopped away. And so remember that the vast majority of absorption occurs in the small intestine. So if We're talking about micronutrient absorption. So if you have part of your small intestine removed, you're going to put yourself at lifelong risk for malabsorption of vitamins and minerals. And that's lifelong, that's forever. And so if this is something you're having done, or if this is something you've had done, either one of these surgeries, then you need to just be aware that for the rest of your life, you should be prioritizing with your doctor that you have your vitamin and mineral status checked twice a year, not once a year, twice a year, so that you can make adjustments in any kind of nutritional supplementation that you might need because you're missing, a section that is responsible for that absorption. So it's very, very important that you understand that if you want to have a minimal quantity of lifelong complications as a result of malnutrition. And then there's gallbladder removal. This is, I think last time I checked, this is the #1 surgical procedure. In my opinion, it's #1, but it's also probably the most unnecessary surgical procedure. The gallbladder, unfortunately, is considered by doctors, this is a shame. I'm kind of embarrassed to say this, but doctors consider the gallbladder as an organ to be non-essential, meaning in what they're referring to is you don't need a gallbladder to stay alive. But to say it's non-essential, I mean, the gallbladder has a purpose. Just like your pinky finger has a purpose, and you wouldn't want somebody to lop that off because you had a bruise on it. Same thing here with the gallbladder. And so gallbladders are being removed at breakneck speed in most industrialized countries because people have what's called gallstones, or they have problems with digestion because they're eating poorly, and so the food that they're eating is actually damaging their liver and gallbladder and creating the need for doctors to want to pull this organ out of the body. And so the problem with that is the gallbladder, when you remove the gallbladder, remember the function of the gallbladder is to secrete bile acid or bile salts into the small intestine. And the job of bile salts is to emulsify fat, which is very important because we have to emulsify fat. Why? Because we got to make fat capable of being absorbed. And so you think about what that looks like. If you don't do that well, the vitamins A, D, E, and K are all fat-soluble vitamins. And so over time, what happens in my experience at around year 5, 6, and 7, post-cholecystectomy or gallbladder removal, we start seeing these deficiencies showing up in big ways. Also, we also need to put on here omega-3 fatty acids. And so it's already, vitamin D and omega-3 are already extremely common deficiencies in people with gluten-related malabsorption. So now, you take that same person, you remove their gallbladder, they're already at risk for these, and now you've just compiled that risk and made it a greater problem. So these surgeries, again, are surgeries that have a direct impact on nutrition, not just from the traumatic aspect of having to heal from the surgery, but from the ability to digest and absorb the nutrients from the food that you eat. We look at this other study here. So malnutrition as a complication of bariatric surgery, a clear and present danger. And you look here, this is again the summary. Types of malnutrition after bariatric surgery include protein energy malnutrition, which I said earlier, protein, right, because of the lack of stomach acid. And then deficiency of micronutrients such as iron, folate, vitamin A, vitamin B12, to name a few. And then you can go on to say bariatric patients who do not adhere to the recommended diets are at a greater risk of developing relevant malnutrition. Therefore, lifelong post-operative clinical and laboratory monitoring is necessary to diagnose deficiencies of vitamins, trace elements, and minerals, and to correct them with supplements. Unfortunately, no standardized aftercare regimes exist for these patients, and the costs for nutritional supplements are paid for by the patients themselves. So basically, let's just take the meaning of that. What we're saying is, your insurance will cover the bariatric surgery. The bariatric surgery will permanently damage your body's ability to absorb nutrients. You have this massive increased risk of developing the deficiencies as a result of that surgery. And the whole point of that surgery was so you could lose weight and be healthier. And now you're causing lifelong malnutrition that now your insurance company won't even pay for you to test or to have covered. And you can see here, no standardized aftercare okay, regimens exist for these patients. This is about 15 years ago. I used to go around the circuit, the lecture circuit, and I would teach nationally. I'd go to different doctor centers, but one of the places I would commonly frequent within my lectures would be bariatric surgical centers. So I would go into the different hospitals and I would talk to different bariatric surgeon groups, and I would teach them this stuff. And I would say, look, you guys are missing a huge opportunity to help people, because the surgery that you're performing is putting their life in jeopardy long term, and it's creating the unnecessary risk of malnutrition and secondary complications associated with that. And all you have to do is institute within your group some type of process whereby you're following up post-surgically with these patients. At the very least, make sure you educate these patients and refer them out to the proper expert in nutrition so that they can be monitored consistently over time. And I was always met with scoffing. I was always met with, well, we don't have time to do all those types of things. We don't really care about what happens to them afterwards. We just want to make sure they get the surgery. Like, that's the type of mentality that I was met with. And so I always just questioned the bariatric surgical profession as a whole. Like, if they really cared about their patients, they would talk about this, because this is, this is common knowledge. This is not, it's not like this esoteric thing that sometimes happens. This is a very frequent occurrence, and post complications are quite common. Now, let's switch gears over here to this research study. You can see here, cholecystectomy. Cholecystectomy is just a fancy way of saying gallbladder removal. Okay, but cholecystectomy and risk of metabolic syndrome. And so this is just a diagram from that research study where you can see down here. I'm not going to go through all the biochemistry, but let's just summarize it. That post gallbladder surgery, these things happen, and that increases the risk for fatty liver disease, which then leads to an increased secretion of glucose from the liver, meaning that now your body's being bombarded with glucose, and that increase in glucose puts pressure on the pancreas to make insulin, and so now you get an increased risk of overproduction of insulin, and then ultimately what that leads to is insulin resistance, which is just another way of saying diabetes, right? Because by the time we're developing insulin resistance, we're not processing sugar very well. And so now, again, the surgery itself increases the risk for metabolic syndrome, which is what the article is saying, but this is the mechanism by how that is actually happening. You can see also that one of the other things that occurs as a result of the surgery is an increase in pro-inflammatory adipose cytokines. So these are chemicals that are derived from fat cells that, when released by fat cells, cause an inflammatory cascade. And so these increased inflammatory cytokines also contribute to elevations in hormones like leptin, which makes people resistant to weight loss. And so what actually ends up happening post-surgically is people gain weight. They become more and more obese. So again, this is a risk, a very well established and very well understood risk associated with people having gallbladder surgery. So when your doctor says your gallbladder is not an essential organ, you ask him what the post-surgical complications are. And if he doesn't explain this to you, then you probably need to find a different surgeon, honestly, because if they're not willing to give you informed consent of the risks that you're going to struggle with as a result of the surgery, then you probably want to reevaluate whether or not you even need the surgery. Okay, so moving on, let's talk about what happens during and after surgery. So one of the other things that we have to worry about nutritionally with surgeries is that a lot of the drugs given for surgery, so whether, a lot of times when people go into surgery, their doctors prescribe an antibiotic in an IV bag, right? So you're being pumped full of IV antibiotics during the surgery. But then after the surgery, you get a couple of prescriptions. Usually it's some type of steroid to reduce the swelling and to reduce pain. And it's pain medications. And typically the most common, in today's world, not so much opiates, but these are still prescribed. And then you get what are called non-steroidal anti-inflammatories, NSAIDs, drugs like ibuprofen, or meloxicam. So these are drugs that reduce pain post-surgically, so they're trying to provide you comfort after the surgery is over. But a lot of people don't realize that some of the side effects of the antibiotics is they reduce B vitamins. There's a lot of research showing that B vitamins actually have anti-inflammatory and anti-pain effects. So, the very drug that's being administered during the surgery creates a B vitamin deficiency that has an effect on whether or not you're going to hurt more or not. And then we have steroids. And so we know the steroids will deplete, calcium and magnesium and vitamin D, which is a major regulator of how much pain that you feel. Steroids will reduce selenium and chromium and vitamin C. And vitamin C is something that naturally, I recommend anybody post-surgically take higher doses of vitamin C, because vitamin C helps with the formation of collagen and collagen cross-links, so it aids in the healing process post-surgically. But vitamin C is one of the most powerful anti-inflammatories, natural anti-inflammatories known. So again, these medicines deplete these very key nutrients that your body is going to need more of in order to overcome the scheduled trauma of the surgery itself. And then you also have non-steroidal anti-inflammatories, and these will reduce folate. There's a number of studies showing that NSAIDs lower folate, which folate is necessary for the protein synthesis around especially if you're having like a joint surgery. So like you need folate to make new cartilage. You need folate to regulate inflammation and pain mechanism of serotonin production and dopamine production. But, additionally, iron, NSAIDs can cause iron deficiency and vitamin C deficiency, so they don't come without a cost either. And so what you're left with is, if you're doing a lot of this post-surgically, you're causing a lot of drug-induced malnutrition, but you've also got surgical-induced malnutrition. And so now you're combating two medical treatments here, and so now you're in trouble, right? So what do you do? That really becomes the question. What do you do? Because sometimes sometimes you need some pain relief after surgery. Don't get me wrong. I'm not telling you all to bite down on a leather bit and take it. But you got to understand that the malnutrition from a surgery already, and then add the drugs, is going to lead to complication. And one of the biggest complications is failed surgery syndrome, or the surgery itself creating long-term consequences because of its failure, where what you set out to do which was get better, and now you're not getting better and you're getting worse. And so there are greater degrees of complications coming from that. So let's talk about some things that you should do nutritionally if we're talking about healing from surgery. So a couple of things that I want to make sure that we address is, number one is this list here. So this is, just so you know, this is not an all-encompassing or comprehensive list. The number one thing I would request that anyone do, and this is anybody that comes to see me, if they're scheduled for surgery, the number one thing that we try to do to prepare them for surgery is test nutrition. We want to know, at least 6 weeks out. We want to know 6 weeks out, easy, because surgeries are not just something you go in, unless it's an emergency surgery to save your life. They're not something you just go in and do tomorrow, right? They're something you plan for. And so as you schedule it out, you should work with your doctor so that you can test your nutrition at least 6 weeks in advance. In this way, once you know where your needs are, what are you low in, now you can get a nutritional supplementation protocol going way early, right? So what are you doing, in essence, by doing that is you're going into surgery not malnourished, but very, very well nourished and supported, so that your outcome of complication risk is diminished greatly, and your outcome of a positive surgical healing is also enhanced. So, test it. But if you have, let's just say you don't have anybody to do any testing for you and you're stuck here, these are things, this is just a short list, and what we'll do, I'll put in the description below, I'll put my general pre-surgical, post-surgical protocol for you guys, so that you can access that and know kind of what I will generally recommend somebody do if we're not getting testing done. right? So these things here, these are very critical. Amino acids, specifically these two. BCAA is not one amino acid, but BCAAs that stands for branched chain amino acids, the valine, leucine, and isoleucine. But these are very, very important for the knitting and the repair of the skin and the muscle that's being cut through oftentimes during a surgical procedure. So very, very critical for healing and repair. Same thing with glutamine. So all the amino acids are great, but these four, the branched chain and glutamine, are very, very critical for the healing and repair of muscle. So if you're having like a joint replacement surgery, a hip surgery, back surgery, if you've got having an advanced laminectomy or something like that in your spine, like these you definitely want to have. Collagen, supplementing with collagen, and it's important to get multiple forms of collagen because your body makes multiple forms of collagen. Now, how does your body make collagen? It makes it from amino acids, but it's very important to take a collagen protein, in my opinion, pre-surgically to make sure that your body has the protein and the collagen source so that it's there in abundance and ready to help you heal after the fact. Vitamin C and quercetin, so we'll just kind of combine these two because these two together, they work in the same area to control inflammation and to control swelling as steroids. So they work in the same cell location as steroids without the complications, right? And so again, a lot of doctors want to use steroids, but the problem with steroids is they cause malnutrition, and one of the nutrient deficiencies caused by steroids is vitamin C. So again, you can combine these two in stronger doses. Generally speaking, adult males, 5 grams of vitamin C, 5 grams of quercetin concomitantly together in divided dose over the course of a day is very, very supportive of healing post-surgery. And then copper and zinc are very important. Copper and vitamin C, so we talk about copper and vitamin C, together form collagen cross-links. So collagen is this trihelix protein. So if you imagine I'm drawing kind of a blown up diagram of what collagen looks like, but in between the ladder rungs here, you've got these cross links that form in collagen. And these cross links cannot form without copper and vitamin C. And that's why these two are so important, because remember, when you're having surgery, you're breaking through, and collagen is the structural protein of the body that helps you heal and repair. So you want to have enough vitamin C and copper to form these cross links. Why? Because the cross links make your collagen elastic and they make your collagen strong and resilient. And if you don't have enough C or copper, then what ends up happening is you do form collagen, but you form that collagen without these cross links, and so that collagen is more prone to breaking. It's more prone to rupturing. So now you've got secondary complications where your wound is breaking open or your wound is not healing adequately. So you got to have copper and zinc, or copper and vitamin C, to recover post-surgically. Zinc is very critical for synthesizing and helping your body produce a number of different proteins. And so very, very critical for the healing and the repair process. It's also very important to help to reduce post-surgery infection complications. Remember, zinc is very powerful. It's a very powerful antiviral, antibacterial, and so your body uses zinc to protect you. Your immune system uses zinc to protect you, and so it's very common for surgical site infections to form post-surgically. So zinc's very important for that as well. And then the other thing I would highly, highly recommend is a high-quality multivitamin, multimineral. And if you're using any of our supplements, I would recommend like ultra nutrients or multi nutrients in this case for this, because that high quality multivitamin, multimineral is going to have a barrage of all the B vitamins and multiple different nutrients, minerals included. So it's like covering a lot of bases in one particular supplement. So these things, I would say, as a bare minimum, are things you want to consider making sure you have enough of. Now, let's talk about beyond testing. So you can also get tested and you can get specific. But one of the things that we often get told is stop supplements altogether, right? Stop all supplements. Usually the doctors will say anywhere for like 1 to 2 weeks. prior surgery. And this is terrible advice, in my opinion, terrible advice. You should never make yourself less capable of healing before you go in and get scheduled trauma. That's just bad advice. And the reason why doctors say this is I always know which doctors know anything about nutrition and which ones don't because of this statement. Because some really smart surgeons that I know will tell you, look, I don't want you to stop all supplements before surgery. I want you to stop certain ones before surgery. And so what are those? The ones that generally will thin down your blood. What doctors or surgeons are trying to do is reduce the complication that your blood is so thin that you have excessive bleeding during the surgery, and it makes for complications. So we want to avoid supplements that thin the blood. What are some of the most common ones that can thin the blood? Well, vitamin E, high doses of omega-3 fatty acids. Those of you who may be taking ginkgo, ginkgo biloba. Ginkgo is a natural blood thinner. Things like nattokinase, if you're using like an enzyme that has blood thinning capacity. So nattokinase is a common over-the-counter enzyme. Proteolytic enzymes can thin your blood. So if you're taking generally these things, yeah, stop them. Follow the doctor's advice and stop them. But if you're, and I would say again, omega-3 is really not a huge risk of over-aggressively thinning the blood, nor is vitamin E. I mean, unless you're mega dosing them. And when I say mega dosing, like vitamin E, several doses, generally speaking, adult males, 5 grams of vitamin C, 5 grams of quercetin concomitantly together in divided doses over the course of a day is very, very supportive of healing post-surgery. And then copper and zinc are very important. Copper and vitamin C, so we talk about copper and vitamin C, together form collagen crosslinks, 4+ grams of omega-3 in supplementation a day. Yeah, you don't want to do that because those higher doses can do this. And of course, this is what your surgeon is trying to have you avoid happening. But to just make a random or a catch-all statement and say stop everything is terrible advice. Because look, I mean, vitamin C doesn't thin your blood. Quercetin doesn't thin your blood. Proteins and amino acids don't thin your blood, right? But these have huge benefit, right? Tremendous benefit for your recovery. So why would you want to stop them before if they're going to help you in your recovery? As a matter of fact, when I used to be in a hospital environment, one of the things that we saw was that people, and this was in a burn unit, the people in the burn unit, one of the things that happens when somebody has a lot of horrific burns over their body is they need nutrients to recover, and one of the nutrients is glutamine. And so patients in burn units that are severely burned all over their body, when you IV glutamine into these people, they can heal 2 to 3 times faster than people who don't get any, right? So that, certain nutrients are very, very valuable when there's trauma involved. Again, trauma in this case being, example there being burning, but, scheduled trauma, which is surgery. So again, the best thing that you can do before surgery is get tested. 6 weeks out or longer, get tested so that you can start really well a tailored supplement protocol to help support your body's ability going up to the surgery. And then once the surgery's over, okay, so I know doctors will tell you stop all supplements 1 to 2 weeks prior to the surgery, but as soon as that surgery is done, as soon as it's over, now you want to get right back to nutrient support, because you want to do everything that you can. You want to give your body every advantage that you can to improve your absorption and your ability to get vitamins, minerals, and trace nutrients so that you can heal and repair, because that trauma is going to require a lot of healing and repair, and you're going to need those extra nutrients to do it. So if you're scheduled for surgery, make sure you take this information, and before you get it done, talk with your doctor about testing, talk with your doctor about supplementation, and if your doctor's like a nutritional IQ of 0, like ask him for a referral to another doctor who's a specialist or an expert, especially somebody who may be an expert in supporting people pre and post surgically. It'll make a light years of a difference in your outcomes. Thanks for tuning in to the Dr. Osborne Zone. Don't forget to share, like, and subscribe for more content like this, and make sure you come back next Tuesday at 6 p.m. Central Standard Time and Thursday at noon 30 for more episodes.